a lot of people have low neck and chest and thoracic pain, or pain in the upper back. And I have developed through the O'Connor technique a way to determine if that pain anywhere in this region, even including what is sometimes felt as heart pain, and people have had $40,000 workups, and the doctor never did what I'm calling a diagnostic circumduction to determine if the pain originated in the spine, and the spinal nerve, as it was going around the front, gave a person the symptoms of chest pain, like almost like a heart attack. And so this technique, which I've described as a diagnostic circumduction, relies upon the understanding that a normal thoracic or upper back disc has to move through its range of motion in a circle. That's something that a lot of practitioners don't really understand about the spine, is that it not only bends forward and back and to the side, but part of the spine's functioning is that it moves in a complete circle. That's what the word circumduction comes from. And if that piece of disc material is popped out to one side, as you attempt to roll around, it will stop you. It will not allow you to complete a circumduction, because you'll run into that piece just like a pencil in a door hinge. It's a mechanical obstruction to the normal circumduction of the spine. Now, one thing about the upper back, from the neck to about the start of the low back, is it's a very rigid part of the spine. It's a very difficult part of the spine to move, actually. It's meant to be rigid. The lumbar and the cervical spine do a lot more movement, and it's more difficult to diagnose a thoracic disc than it is a cervical or a lumbar disc. But it can be done, and I'll show you how it is done. By taking your hands and putting them on your hips and pushing down, you can unweight your spine a little bit so that it allows you to bend forward, whereas if it's in pain, it's sometimes the spasm prevents you from bending forward, and you might want to go, oh yeah, I can do that. That's not my problem. When in reality, you never really gave it an opportunity to really prove that a displacement syndrome exists. So what you do for the diagnostic circumduction of the upper back and the thoracic region is you push down a little bit. That allows you to bow your chest and your thorax forward, and if you go to one side or the other, you start on one side, you lean your body to that side and you roll around, only you're pivoting around the area of pain. If the pain is like in this region, that's where you want to pivot. You actually want to pivot around the spot that hurts, because that's where the mechanical obstruction is. And you'll find one side of that mechanical obstruction, like this. As you roll around, it'll stop you. You'll get the pain. You'll feel that, yeah, right there something aggravates that pain, and I'm not able to move completely back and stop. I'm stopped, or my circumduction is arrested if I try to bend too far this way and lean back. As you start to lean back, it starts to hurt. That one side of the pie of lost range of motion in the whole circle of circumduction. Now, to find the other side of it, and usually in the thoracic spine, the disc either goes one way or the other. So you will probably, if it's a disc that's out to the right, you'll probably be able to go to the left and come all the way around and all the way to the back. And then when you get about to the midline in the back, it starts to hurt you again. Because what you've done is you've moved around to the other side of that bulge. As you roll around, you've met the other side of that bulge. And you met on the first when you were bowing forward and you're going to the right, you meet the one side of it, it won't let you go through it, then you're able to turn all the way around to the other side, and when you roll around to the other side, you may even be able to go across the midline, and then all of a sudden it's going to stop you again. Then, when you find that, you can be reasonably assured that it's not a lung tumor, it's not a heart attack, it's not a kidney stone, it's not some strange, a lot of people say that the rib is dislocated or something like that. You can prove to yourself that it's an actual mechanical interference to your circumduction by a piece of cartilage-like material that is displaced. It's moved out to the side and acting as an obstruction, like a pencil in a door hinge, to your normal circumduction. A normal person should be able to normally circumduct, back and forth over that, test it, go back and forth over that, test it. I'm a 63-year-old man and I can do it. And there's no reason why anyone else can't figure out that when they try it and it stops them, that's where the problem is. And if they had gone to another practitioner, say for chest pain or something, and that practitioner didn't test with a diagnostic circumduction what was wrong with them, they're going to miss the opportunity of diagnosing a thoracic disc displacement syndrome, and you may be treated for chest pain of lung origin or chest pain of heart origin. And I've seen people spend $40,000 in the emergency room, come to me, in 40 minutes I click them and put their disc back in, and it's like a office visit cost versus $40,000. Now that's an amazing ability of an individual to diagnose themselves, because in some cases you'll be stuck diagnosing yourself because the doctors really don't understand this concept, and they don't really understand the mechanics of the disc. Even chiropractors don't do this because they don't know the mechanics of the disc like I do, and I will teach you in the O'Connor technique. And then when the disc is out, and you have to understand that the thoracic disc is a little more hard to get back in, because the thoracic disc doesn't move much, and it's harder to displace a thoracic disc, but when they get displaced, it's harder to put back in. But the O'Connor technique will teach you a series of specific movements in a sequence, and it has to be in that sequence, to actually take that piece of displaced disc material and through this specific sequence of movements put that piece back in, and when you do, instantly you've got your range of motion back. Now, an interesting thing about the thoracic spine is the pain doesn't always just instantly disappear. It reduces markedly, but sometimes it takes a day or maybe a couple hours or something before that actual pain goes away. For some reason, a lot of times you can put a cervical or a thoracic disc back in, and it isn't the amazing treatment that works for the neck and the lumbar spine. But the way to know if you did put it in is you do a diagnostic circumduction. If you can, after using my maneuvers, can go through a full range of motion without arrest or interference, then you've put your disc in, and it'll tell you when we get to that on the maneuvers how to manage that, and within probably 24 hours you'll be pain-free and have your full range of motion back.